our second guest speaker is Madam Jemimah Kimeu. Madam Jemimah Kimeu is the Chief Nursing Officer, the Aga Khan University Hospital, and purposely she will be very key. She'll be sharing the real-world experience from a facility where she's the head, where there is HCAs already and CNAs and the nurses, how they relate with that collaboration between the two people, the two group of people with clearly defined roles. She's offering practical insights on safe delegation, note, teamwork, and maintaining professional boundaries in patient care. Please applaud Madam Jemimah Kimeu. Thank you so much, Madam. Number 3, our guest speaker and our presenter is Dr. Abdi Maalim. Dr. Abdi Maalim is the chairperson of the Board of Management of Nursing Council of Kenya. Dr. Abdi will be providing regulatory leadership while also representing academia, bridging policy, education, and practice to strengthen nursing standards and professional development. Again, participants, please applaud Dr. Abdi Maalim. Thank you so much. Last and not the least, we have Dr. Ann Mukuna. Dr. Ann Mukuna is the Director of Standards and Compliance at the Nursing Council of Kenya. Dr. Ann will be very keen because she will be driving this conversation on standards, compliance, and enforcement, ensuring nursing practice aligns with the regulatory frameworks and safeguards patient safety. Then I will introduce our moderator. Before I lastly, then I will say my name. Our moderator, my co-moderator is Mr. Jephters Olwero. Mr. Jephters Olwero is a clinical nurse specialist, specialized in critical care and healthcare system management. He also has advanced leadership on healthcare management and also has an experience or is experience in quality assurance in health systems. Jephters and I will be moderating. My name is Purity Anampiu. I'm also a clinical specialist in critical care, holding a master's in nursing in critical care. We'll be moderating together. Thank you so much, ladies and gentlemen. I will now hand over to Mr. Jephters Olwero. Thank you so much.
Well, thank you, Madam Anampiu, for the explicit introduction to our team. And once again, good evening, everyone.
Good evening.
Good evening.
Thank you. My name is Jephters Olwero, and I am going to be the one of your moderator for this today's session on scope of practice on the roles of the HCA, or we call it the CNA, and nurses in patients' care. So this is not just going to be a theoretical discussion, but a scope of practice that directly affects patient safety, professional accountability, and legal protection in our daily work as registered nurses in the NCK registers. As we engage today, to our panelists, please, we are going to encourage you to provide practical contributions from your clinical experience, administrative experience, and academic experience and training experience. We are also encouraging respect for professional boundaries, focus, and we want you to focus on safe, patient-centered care. And also, we also encourage you to have an open, honest, and constructive discussion. Briefly, before I open the floor for the discussions, we need to understand what nursing scope of practice and patient safety is in our context in the Kenyan system and Africa at large. So nursing is the backbone of healthcare delivery in Kenya. And our president, NNK president, said that it is the 80% of the workforce is nurses in Kenya. We provide safe, skilled, and compassionate care across all levels of the health systems. As healthcare demands grow currently and the workforce pressure increases, concerns are emerging regarding unclear role boundaries, weakened accountability, and patient safety risks. So our goal today is to promote patient safety and strengthen nursing practice in Kenya through dialogue that we have organized today, policy engagement and shared learning on scope of practice, delegation, supervision, and regulations. This is going to be purely virtual professional talk show with the high-level senior health or nurses in Kenya, and we will be moderating this discussion with questions and answers, where each panelist is required to take 2 minutes, with 1 minute given in addition to provide their insight on the issue that has been discussed, that has been asked. As healthcare demands grow and workforce pressures increases, there is emerging supportive healthcare cadres that have become part of the care team, contributing to service efficiency and patient comforts. However, in many facilities, concerns are emerging regarding unclear role boundaries between licensed nurses and supportive staff. We call them the HCA, or whatever name that we have given them. And also the responsibility traditionally reserved for trained and licensed nurses are being performed outside the established professional scopes in certain hospitals as an issue that has been raised across. So this is leading to role confusion, patient safety risks, reduced opportunities for our nurses, and weakened accountability, with also legal and ethical challenges and diminished recognition amongst the nurses. So our aim today is to examine current challenges, discuss patient safety, explore supervisions, and share international best practices in collaborative nursing models that is in existence, and propose regulatory and policy recommendations to strengthen governance. So we have our expert voices at the table from various fields, from the Nursing Council of Kenya, from the Ministry of Health. We have a representative from National Assembly. Kenya Nurses in Diaspora are also following, and also the Nurse Academia. So key discussions is purely going to be scope of practice and put in mind the patient safety. So we have questions for our panelists, and also the audience are also encouraged to send their concerns, questions, contributions in the chats, and this is going to be discussed and raised by the co-moderator, Madam Anampiu. Above all, we are opening this platform for our panelists with the first question, and this is our response. The number one is going to be our regulator to set for us the standards, from Dr. Mukuna from Nursing Council of Kenya. With the due respect, our panelists take note of the question. Question number one: as a matter of concern, how do we clearly differentiate the scope of practice between healthcare assistants, or some people call it certified nurse assistants, and registered nurses in real clinical settings? And let us not just have the theory part, but let us move from textbook definitions to actual world realities. So as we open the floor to our first panelist to respond, I repeat the question, if not clear. How do we clearly differentiate the scope of practice between healthcare assistants and registered nurses in real clinical settings, not just in theory? So let's open the floor for Dr. Ann Mukuna.
Thank you very much, Jephters, and thank you, Let's Talk Nursing fraternity, and all colleagues present to have this discussion on the scope of practice and the perceived overlapping mandate and overlapping between the nurse and the healthcare assistant. Colleagues, allow me to start by saying that the nursing and midwifery profession is regulated by the Nursing Council of Kenya, which is established at a clear mandate, Cap 247, Rules of Kenya. In the healthcare space, it is unfortunate that there are many cadres. There are about 42 cadres, healthcare providers, but only 11 of these at the moment have regulation. The rest are not regulated, and these include the healthcare assistants. And therefore, theoretically, the healthcare assistants, since they don't have a regulator, they also don't have prescribed scope of practice or a prescribed duration of training, which makes it very varied across the different institutions that are training this cadre in terms of the content that is given to the student and in terms of what they can do eventually when they leave college. And that is a gap that we are experiencing. It is here with us. Having said that, in the healthcare profession, there are many healthcare providers. And if we all put ourselves in the shoes of the patient, our concern is what the healthcare provider can be able to do for us. How are they responding to our healthcare needs? And therefore, the question for us as the nursing and midwifery fraternity is how different are we in what we do to the patients as compared to the healthcare assistants. When we approach patients and the healthcare assistant approaches the patient, do the patients get the difference? Are our communication skills a bit higher than what the healthcare assistant is able to do? If we are taking the blood pressure, would the patient feel that this person knows more than the person who took my BP, a minute or 2 hours ago? And therefore, it all comes back to us. How do we carry ourselves as nurses and midwives of this country? How do we protect our professional image? How do we assert ourselves in that space and in accordance to the scope of practice that the Nursing Council, our regulator, has prescribed, for each of the nursing cadres? Failure to do that, then we find that these unregulated cadres will start encroaching and driving the radar, because there is going to be that vacuum. And in nature, a vacuum does not exist. Nature has a way of filling up those spaces. And therefore, it is a wake-up call to us to assert ourselves, to protect our professional image, so that even when we do the same task, that the patient can realize there is a difference from how we carry ourselves, from how we conduct the task, from how we approach the patients. Thank you very much.
Thank you, Dr. Anne Mukuna, that was quite profound. We hope everyone understood. And let's give an clap. Thank you. An applause for Dr. Anne Mukuna. And
yes, before you continue.
Thank you.
Jephters.
Yes.
Before you continue, I want to appreciate and also recognize Dr. Lista Osogo, who is currently the Registrar of the Nursing Council of Kenya. Please, participants, welcome Dr. Lista to this meeting. Thank you, Jeff. Continue.
Welcome, Dr. Lista Onsongo. And feel at home. We recognize your presence. So to our panelists, we have 2 minutes to answer the question and also give lead guidance. And the question was, how do we clearly differentiate the scope of practice between healthcare assistant and the registered nurses in real clinical setting? And we thank Dr. Anne Mukuna for giving a guidance. We welcome Dr. Abdi Maalim, a senior lecturer and also director, chair, board of NCK Nursing. Please go ahead, Dr. Abdi Maalim.
Good evening, colleagues.
Good evening, Dr. Abdi.
Salam alaikum.
Good evening, Doctor.
Good evening.
Alaikum salam.
Thank you.
Walaikum salam.
First, I would like to, I know you have given 2 minutes, but let me use my 2 minutes in the first place to thank the organizers, Otieno and your team. We sincerely appreciate. Otieno is doing something with some of us who are nearly half a century in the profession, but not have done that. And we sincerely appreciate Otieno and your team, what you're doing. Second, when I have my technical people in place, Dr. Mukuna and Dr. Lisa and others, I'll maybe make my comments later on. But just to add what Dr. Mukuna, a very senior professional and well-seasoned academic also, and who's also the chair, the director of our standards and the rest. She mentioned actually the correct statements, because you can only gauge something when you know, or gauge my certificates when you know who offered me the certificates and who prescribes what I will do or what I will not do. And in this case, this is really where we are at the moment as healthcare assistants. I would not like, and I want to make this very clear, we should not at any one time use nurse assistant. The moment you use the word nurse, that is a highly, professional term, which is only reserved for those who have gone through a prescribed period of training and directed by a regulatory body. And here we have none other than the Nursing Council of Kenya. So I would not like to hear anybody talk about nurse assistants or whatever. And I want to be very clear, and we have several lawyers here in the nursing profession now, which is actually an endowment to the profession, and others. The moment you use the word nurse and you don't have any prescription or license from Nursing Council, you must know that you are actually impersonating someone, and we can take you to court. I stand corrected. Secondly, this word healthcare assistant has been in the market for quite a time now, and mostly this is the way is what's coming up in the more developed organizations or countries. And I will not agree, and I would like to preserve my comments for later. But at the moment, Kenyans, we have what the Dr. Ann said was actually we lost the chance. I was trying to Google about this in America and where they did. And in America and other developed places, they have got people who are regulating this. And one of the institutions that regulate this type of cadre is actually the nursing profession. But unfortunately, we left out the nursing council and the rest. We never bothered. But what we see now, these are people who are doing functions which are actually meant for the nurse, but at the same time, not being under the direction or under the training direction of the Nursing Council of Kenya. But it's a profession now.
Thank you, Dr. Abdi.
Sorry?
Thank you, Dr. Abdi.
Oh, yeah. Okay. I'll reserve my comment for later.
Thank you. A matter for clarity, do you mean there is no scope of practice for the healthcare assistants given by the Nursing Council of Kenya?
Nursing Council does not train healthcare assistants.
Thank you very much.
And we don't prescribe. We only train those whom have prescribed. We only give what you call scope of practice for those whom we have training and have gone through our curriculum. And I stand corrected that the registrar is here and other technical people. Nursing Council does not regulate healthcare assistant in Kenya.
Thank you. Thank you, Chair. Thank you for that clarity and that purpose. And let's clap for the Chair. Wow, that was quite insightful, quite wonderful. And we encourage you to preserve the comments for the closing remarks because it seems you have a lot for us to learn. You are a role model to us, and we wish we can also be like you. Otherwise, to our third panelist from the Nairobi Hostel, Madam Jemimah, sorry, not Nairobi Hostel, Aga Khan University Hostel, Madam Jemimah Kimeu, who is a Chief Nursing Officer, where they are currently and actively utilizing the services of healthcare attendants in providing nursing care. Kindly, Madam Jemimah Kimeu, how would you differentiate the role of the scope of practice between healthcare attendants in your hospital and the registered nurses within the same system?
Thank you, Justus, and the organizing committee for this wonderful session and also for having me. Hi, colleagues. It's a pleasure for me to share the experience of the Aga Khan University Hospital that has utilized or hired healthcare assistants for a long, long time. And I just want to share how the implementation was done and how it works, so that there is a clear delineation of accountability and also responsibility and also what roles. So the issue of healthcare assistants, as everybody has said, has been thorny for nursing profession for as long as I can remember. And unfortunately, other than the issue going away, actually it is becoming even more serious because training facilities are mushrooming, private entities are hiring the healthcare assistants, even where there is not a one single nurse for supervision. So there are many, many questions we can ask as to why. Why is this mushrooming? It is continuing other than stopping. Now I know I only have 2 minutes, so let me share the Aga Khan University Hospital experience where I am the Chief Nursing Officer. So what was done or what has been in existence in terms of these two roles or this cadre, it's actually very clear structures which are governed by institutional policy, job descriptions, decent nurse-patient ratios, and the fact that the overall accountability for patient care remains with the primary nurse. So, for example, a nurse who is taking care of 7 patients, 8 or 9, is assigned a healthcare assistant to help with those duties that do not require skills. And I'm talking of hygiene, I'm talking of sometimes mobilizing from bed to sitting. At Aga Khan, they don't do vitals because we are very, very clear. Anyone doing vitals must be able to interpret vitals and relate vitals with the diagnosis and the clinical condition of the patient. So at Aga Khan, they do basic duties to assist the nurse, so that then the nurse is left with a high level duties that require skills, that require critical thinking, like medication, assessment, pre-assessment, all those things. And then the nurse now is relieved of the duties that generally tend to tie nurses until they are not able to participate in ward rounds, in clinical discussions with physicians. So for us, we picked from the scope of nursing, we picked those jobs which do not require a lot of skill. And I talked of hygiene, for example, a bed bath. But the primary nurse who has all those patients must also decide which are the patients that cannot even be bathed by a healthcare assistant. For example, in critical care patients are never bathed by a healthcare assistant. So it is also the job of the primary nurse to actually do assessment and decide, out of my 7 patients, which are the ones where the assistant can even mobilize out of bed. So basically, the healthcare assistant for us is someone who assists the nurse with those basic care duties, but the overall accountability remains with the primary nurse. We do not have at any given time where a court case comes because a patient fell and we say that patient fell because a healthcare assistant was bathing. No, it is the primary nurse who remains accountable for the patient. So, as I said earlier, what has worked is institutional policy, very clearly written about what the healthcare assistant does and the level of supervision. And then at institutional level, we continue to train on those basic stuff. Like, for example, even bed bath, people still need to be trained. So we do have a whole department that constantly puts the healthcare assistants together with demonstrations. So what I'm saying is, in places where utilization of healthcare assistance is done well, it can be a very beneficial thing, especially for the qualified nurse, because then it increases their satisfaction and the nurse is left to do the high-level skilled duties that are in our job description or in the scope of nursing.
Yeah, thank you very much, Madam Jemimah Kimeu, for quite a wonderful contribution. You've given us an insight for the nursing fraternity to follow. Let's clap for her. And so from take point from Madam Jemimah's contribution is that the healthcare assistants perform those unskilled nursing duties that are quite dependent on the complexity of patient care. So only those stable patients or things that there are levels. That's if I get you right, you said there is a level of providing even bed bath to a patient, and you've delineated clearly the kind of the type of patients that an HCA can provide bed bath to, or give of feed, or even take to the toilet. And those the same activities of daily livings, there is a cut-off point for where the nurses begins, if we get you right. And thank you for that.
Yes.
And we do not
Yes,
thank you. Thank you. And let's clap for Madam Jemimah. You guys are doing a wonderful job in Aga Khan University Hospital. It is a benchmark site for many of the hospitals in Kenya. And if Dr. Judith Awinja is in, kindly you can confirm before we proceed to our fourth panelist to provide for us the insights. We have a question for Madam Jemimah from the Nursing Council of Kenya, from Dr. Mukuna. Dr. Mukuna is asking, what is the role of the NCK in healthcare assistance? And someone is also asking questions, who makes the curriculum and which is the licensing body for the healthcare assistance? We shall preserve such questions for the next, for the Q&A sessions. Okay, we are moving straight to the second question to our panelist, and this is a question on delegation and accountability. And the main purpose is to bring out clearly the legal and the practical tensions that surrounds the practice of the healthcare assistance in the Kenyan system, and also the practice of the nurse. If there is any clash, who takes the responsibility, who supervises this healthcare assistance, and to whose legal framework or policy do we utilize in the discharge of duties by the healthcare assistants? So Madam Anampiu is going to pose a question on delegation and accountability. Let's keep tuned. We just want to remind members that when we talk about doctor, title doctor in this platform, we are not referring to a medical doctor. These are highly trained, it's an earned title. These are nurses who have achieved highest level of training, and they have PhD in nursing. So it is a nursing doctorate. Let's don't get confused with the word doctor to mean medical doctor. This is not a doctor. No MO is here. All of them are nurses. So we want to encourage young nurses and aspiring nurses like us to also to attain such titles of doctorate. Otherwise, Madam Anampiu, you can take over.
Thank you so much, Jephters, and it's really enlightening from our first question that we posed. I think members are really excited. You can even see the questions on the chat box, and we'll be very brief so that at least we are also able to address these questions that our participants are asking. So number two, to be guided on through this question, we wanted to know something to do with the delegation and accountability, and I remember Dr. Mukuna has really even touched on it in our opening remarks. So it will just be maybe a few or more additions that we expect. So in this regard, I want to ask our panelists, when a nurse delegates a task to HCA or CNA, as they are called in different areas, where does responsibility end and where does accountability remain? Madam Jemimah Kimeu, the Chief Nursing Officer, Aga Khan University Hospital, would like her to tell us how is it bringing this issue of legal versus practical in the area of work. To you, Madam Jemimah.
Yeah, thank you, Purity. I think I alluded to it in my opening remarks, but let me emphasize again on accountability and the legal aspects of patient care. So when you look at when you are assigning duties and you say, nurse so and so, you are taking care of this X number of patients, that is the accountability for that nurse. Now, any delegated task to a healthcare assistant, the nurse is still responsible. In fact, in our hospital, the HCAs do not appear anywhere in terms of allocation of patients. Instead, you allocate them to the nurse. If the nurse has 6 patients, nurse HCA Mary, you are working with RN Joseph. We never allow any allocation of patients there. And I've seen someone asking about even turning requires some skill. That is where assessment of patient is so key, and reassessment. If I'm the primary nurse, I must assess all my patients before I can delegate tasks. Because even a simple task like feeding, we know if you are caring for a stroke patient and we have not done the swallow screening, a patient can choke. So that is not a patient we are going to just assign to a healthcare assistant. So in short, the total accountability of patient care remains with the nurse, the primary nurse. She is just being given someone else to assist with those light duties that can be done by someone else safely, because patient safety is the key. Patient safety is the key. So total accountability, legal responsibility, professional responsibility, all of them remain with the primary nurse.
Thank you so much, Madam Jemimah. From your remarks, I'm getting it very clear that the primary nurse will do the assessment of the patient, and before even she delegates, she must know that she's accountable for that patient, and she's answerable even at the court of law. So the healthcare assistant, you have also informed us that even in your location, the nurse is allocated. Then after you do the allocation, then the healthcare assistant is now working under that nurse, basically, or that's what I got.
True.
Okay.
You're right.
All right.
So we want to encourage people to continue registering for this session, because it is CPD. We are going to provide a CPD, and not only CPD, but a follow-up to is going to be made. So we are encouraging everyone to register and also send questions that are only related to the topic. Let's limit questions to only the topic of discussion. Thank you, Madam Anampiu. You can proceed.
Okay, thank you so much, Jephters and Madam Jemimah, for that insight. Because I'm still waiting for Leonard to say whether Dr. Judith is on. Will I know Dr. Ann? I know you managed to tackle almost this question, but still you can just go through, because I know there are some members who have joined. After your opening remarks, what is the legal perception of this all this in the nursing practice? Karibu, Dr. Ann Mukuna.
Thank you very much.
Thank you. Sorry for interjection, Dr. Ann Mukuna. We would wish to make it aware to the members that Dr. Judith Awinja has sent her apology. She's held in other activities, an urgent one. We shall proceed. Dr. Ann Mukuna, please proceed.
Thank you very much. And team, allow me to pick from where Madam Jemimah has stopped. The healthcare assistants, since there is no legal framework, at the moment KHPOA is stepping into that vacuum that is existing, because perhaps all the team members present here, if you look back at your nursing journey, the healthcare assistant, the patient attendants, they go by varied names. This category of persons has been in the healthcare system for the longest. And as Madam Jemimah said, the story is continuing and is unfolding. And therefore, we find this category of persons working under the supervision of the nurse. And just like any other form of delegation, before you delegate, the question is, the task that I am delegating to this person, do they have the competence? Does their training allow them to be able to undertake the task? And this is where now we support each other in the role of regulation, because the role of regulation is wide, and in most cases, it almost appears like it is policing. And so we support each other, we hold each other's hand. If it is in your facility, and this healthcare assistant is being assigned duties that are within the scope of nursing, it is upon us to be able to raise our voice at that time. Because as a council, we will not be able to be, in every facility. And by the time we come to the facility, before we interrogate, systems have ways of hiding and maneuvering through all these things. So we all need to rise up to support the profession and to ensure that the tasks that this cadre is performing, that it will promote patient safety. Because we are the ones that are delegating. And therefore, if we delegate this task and then things go south, the accountability remains with the nurse, because they are the ones that delegated the task and they are the ones that are supervising the task. And therefore, we need to stand up and be able to guard our boundaries, be able to know to what extent can this person support me in the care that I am providing, and be able to keep the checks and balances and communicate with management in terms of ensuring that those boundaries are maintained. Thank you.
Yeah. Thank you, Dr. Ann Mukuna. Just a question for you. We'll add you one more minute. You just alluded that the HCA are regulated by the KHPOA, and the registered nurses are graded by the Nursing Council of Kenya, which is true. So now, since we have accepted that they have been in existence for the longest time, and the legal framework is also in existence, and our legal framework is also in existence, is there any contractual agreement in terms of collaborative effort that the Nursing Council of Kenya have deliberately made to have with the KHPOA to ensure that we perform our duties with the strict boundaries?
Thank you very much. If we go back to the Act, KHPOA, just like Nursing Council, is established by an Act of Parliament. And among the roles of KHPOA is not regulation, but there is a gap. There are all these healthcare, cadres that are not regulated, and for which there are efforts now to have them regulated. But before we are able to develop legal frameworks that really stipulate who is responsible for regulating what cadre, KHPOA is standing in the gap. And for that reason, the efforts are towards ensuring that at least there are established mechanisms so that KHPOA, today if KHPOA was to be questioned in regard to what they are doing, it is not in their acts, it is not in their mandate, and so that brings other challenges. But efforts are underway to have not only healthcare assistants, we have the theatre technicians, we have so many others, because as I said, we have a total of 43 health cadres. Only 11 are regulated. So we can see really we have more unregulated than what is regulated. And that in itself is a time bomb because of the lack of accountability and lack of clear scope of practice for most of the cadres in the healthcare space. And so now the effort is towards having everyone regulated, and in addition, ensuring that there is streamlining between the Ministry of Education and the Ministry of Health, so that none of the colleges commence healthcare course before there is approval by the Ministry of Health. And the Ministry of Health will ask itself, what gap are we trying to address by bringing in this new cadre? Is it needed? Is there another cadre that is providing the same or whose scope we can increase so that whatever the skills and competence gap that is being identified can be covered. Over to you.
Okay, thank you very much, Dr. Ann Mukuna, for that insightful remark. We are engaging, and I hope everyone is taking note of the direction. Yes, Madam Anampiu.
Thank you so much, Jephters. Finally, I will ask Dr. Abdi Maalim just to give us a few remarks regarding this issue of legal and practice of this professional who are helping us in the nursing practice. Thank you.
Dr. Evelyn Nyamai, we appreciate your concern. She's kindly requesting if our presenters, the panelists, can present their faces to the camera to enhance communication. Thank you. Dr. Abdi.
Good evening once more. Kindly, I would like to be given some time to clear some of the issues that are raised. I think first and foremost, I'm not sure if there's anybody in age here who is maybe know more about nursing than I do. Maybe very few, if I may ask, or maybe talk like that. I want to correct one thing. The history of healthcare assistance is not even a decade old. What we used to have was subordinate staff in Kenya, and I stand corrected. It's recently that some few people came up with this. It's a practice that is done in developed countries, and we have taken. And I want us to pay, there are a lot of, I have 9 questions which is being put by people on the question and on the chat room, the chat board, which are really pertinent, and they are questioning the Nursing Council. First and foremost, before you say what is the role of Nursing Council and who regulates, there's something called patency in intellectual property. Nursing has a scope, and that scope of practice is what gives us that patency. Those roles and regulations, those roles and activities that we say, this is ours, you cannot take. I think we have led Nursing Council to the dogs. Sorry to say, I mean nursing profession to the dogs. And nobody else did this. I want to be heard heard very clearly. Yeah, nobody did this except the nursing professionals themselves. These are nurses who create roles and responsibilities which are specifically under the purview of Nursing Council and give them different titles. This person says that, I am a nurse working in theater. I scrap for a cesarean section. And here is somebody by the name preoperative theater technician. She is handed, or he is handed, a baby delivered by cesarean section. Handle. That nurse, though, that person knows nothing about how to handle a baby. And when that baby dies, the mortality and everything comes to the nurses. The Nursing Council should not have left this work. I'm sorry to say so. This is where we lost. Today, and I'm very happy what my student, Madam Jemimah, said. She is talking of the theoretical aspect of what is in books and papers. But in reality, these big hospitals have used more of patient attendants with only one person at the name of primary nurse taking the roles of the nurses. And I want to be heard very clearly. The Nursing Council, we will recruit, look for this institute. We will prescribe what is ours, and then we will take it even to the court of law, that nobody else should do what the work is for nursing and nothing else. You can call yourself patient attendant, pre-operative, I don't care. But as far as I am the nursing chair,
all right,
allow me to finish, please. Allow me to finish,
take
kindly.
a cup of, take a glass of water.
Let me finish, please. Allow me
Yes,
to finish.
yes, proceed.
Allow me to finish. We will reclaim any scope of practice that is for nurses.
Yes.
We will reclaim, and we will do whatever it takes so that we preserve the role for nurses and give our nurses jobs. It is these people called nursing professionals who have mutilated the nursing profession. Over to you.
Thank you very much, Dr. Abdi.
Thank you so much, Dr. Abdi and the panelists. They have tackled what we wanted in question 2 very well. And the members have burning questions here. Like someone is even asking, what is the addressing code? So I think Madam Jemimah Kimeu from the Aga Khan University, maybe you can tell us what is the addressing code, the ones that you have. How are they distinguished from the nurses? Maybe that's what people are asking. And who will set the addressing code? Is it the Nursing Council of Kenya or the KHPO, or whichever? Thank you.
Thank you, Purity, for your question. And I feel like we need a all-week symposium to just discuss this wonderful issue and what we need to do going forward. Because really, when you look at it, and Dr. Abdi has already alluded to what happens in the West, where they have CNAs, other people have HCAs, and their roles are very well defined and very well regulated. And I know this is not a popular discussion that I'm bringing into this forum, but I think we may at some point evaluate where we are as a country and think about, do we need someone else also assisting a nurse? And I said before that there are people who are misusing the whole issue of HCAs because of economic benefits. Instead of hiring nurses, they will hire because they know our monitoring systems are weak and all that. But in my view, popular or unpopular, I think as a country at some point, we will have to review and see what we need in future, somebody to assist the nurse so that nurses can also grow and remain really with those skilled tasks instead of also being burdened by some other duties. Anyway, the question was, what about the uniform? The uniform definitely, as every institution will determine, because right now we do not have any regulator for healthcare assistants. So the institution itself determines what uniform the healthcare assistants will wear, which are different from the nurses. So when you go to Aga Khan or any other facility that is using or utilizing healthcare assistants, you will find them, and even their name card. Their name card will be very clear. This is a healthcare assistant and this is not a nurse. So the uniform is determined by the institution because we do not have any regulator telling us what they should wear.
Yeah, thank you, Madam Jemimah. Our question is, since you have the healthcare attendants in your system, you just can, in that our scope of practice and the professional document of practice, the nursing process, from assessment to evaluation. Mm-hmm. Now we're asking ourselves, what is the role of the HCA? To what level? From the assessment to evaluation, what is their role there? Do they have any role in implementing the nursing care plan itself? And and are we legally, or nurses there, are they legally protected when someone performs the scope of practice? That is from the assessment to the evaluation. over patient care?
As we started by saying, everything must be regulated by the institutional policies. In view of that, we do not have a regulatory body that is regulating healthcare assistants, and whoever is employing them in whichever name, then there must be very clear job descriptions. So today, when you look at the scope of nursing and the job description of a qualified nurse, it has everything from assessment, medication, patient hygiene, which is the bed bath, to mobilizing and everything. So many of the institutions will pick those duties that look like they can be done by a healthcare assistant under the supervision of a nurse. And that must be very clearly described in a job description that is given to that healthcare assistant, and it is in the institutional policies, so that it is very well understood that you can only do this. And as I said earlier, even a simple bed bath must include a nurse's assessment, because not every patient should be bathed by a nurse. Now, trouble is coming this way. Many institutions will go that far to have the legal and institutional framework for controls. But we also know there are other places where this is not happening. And this is where we have biggest problem, because then you have this cadre of healthcare assistants on their own. We have dialysis units where really you have only one nurse, all the others are healthcare assistants or technicians or whatever name we are using. So in areas where the structure for supervision, for accountability is not very strong, then there we are very, very exposed, or the employers are really, really exposed, because then we have people providing nursing care, both skilled and unskilled, without defining the limitations. I hope I've answered your question.
Thank you. Thank you very much for that clarity. And with Dr. Abdi Maalim as the government representative, we have Madam Perez Akinyi is giving a very classical concept here, that the training of the HCA is fully recognized by the government of Kenya. And the course is accredited by the TVET and examined by the TVET SIDAC. And the licensing is being done currently by KECHPOA, which is a government oversight authority, so long as they have been trained for a duration of 1 year. Now the question is, this team is fully recognized by the government of Kenya. And where do they dump their products or their produce? They going to dump this LHCA to nurses, or are they going to be supporting doctors? Are they going to support? Why just nursing? And in regards, what is the role of the Nursing Council, by Dr. Mukuna asking a question? What's the role of the Nursing Council of Kenya in the protection of the intellectual property of the nurses? Because whatever they're training to the HCA should never be trained if it had been trained, or the regulation or the training is being provided by the Nursing Council of Kenya. So let's take note on that, as you will respond to that in a later time. Thank you. Madam Anampiu.
Thank you so much, Jeff, and the panelists and our participants. We really note the questions, and time is really running out. So,
and Mr. Leonard Otieno is raising his hand up, and our senior, Mr. Alfredo Bengo.
Okay. So I give
recognize your hands. We recognize your hands up. We shall give you opportunity at the end of the session. Kindly, just bear with us. If an HCA is experienced and skilled in a task, does that justify performing it even if it is outside their formal scope? For example, we have witnessed and had many cases of breach of practice by the HCA, where many hospitals in Kenya are tasking healthcare attendants to give injections and also to insert intravascular lines to patients. Does that justify, even if they're skilled, they know how to do it? Like similarly, like doctors, nurses also knows how to perform CS. Some of the nurses, skilled nurses, knows how to perform CS, and some of the CS knows how to perform intravascular injection and giving medication, IM injections. Does that justify performing it, even if it is outside their formal scope? Back to Dr. Ann Mukuna, as you start.
Thank you very much. And just as you have asked well, if a nurse has experience in performing cesarean section, does that justify them conduct that cesarean section? And we know that once you perform a task that is outside your scope, then you remain legally liable for the outcomes of that. And this healthcare assistant we are delegating tasks. So if I decide to delegate a task that is not within the competence of this person, or they have gained that out of experience. Remember, inserting a cannula may seem like a physical activity that just requires you to see where the vein is. But besides that, the nurse is expected to do assessment, prevent infection, and prevent Ebola. And therefore, it's not just the mere, physical, the skill inserting that task. There is a lot of critical thinking that goes on before the nurse accomplishes that task. Unfortunately, the nursing profession, in many instances, we have failed to demonstrate the critical thinking that goes on before we undertake tasks. If we go to our documentation, what do we find? The documentation does not demonstrate what we do. It does not demonstrate what we know. It does not demonstrate that critical thinking. And so, Jephters and colleagues, I think moving forward, perhaps we need to tailor this discussion. This is very important, and it is helping us shape the discussions for the future. But as even our colleagues have said here, this cadre is recognized by there are governments that have formed MOUs with this country over the training and immigration of this cadre. And therefore, while the nursing profession will not have the powers and the legal mandate to stop the training of this cadre, the question is, what are the strategies the profession is using to safeguard the profession and our scope of practice? What?
Yeah, thank you. Thank you. You will answer
Yes.
that later. You will
Thank
answer that question later. Thank you. And thank you for such a wonderful contribution. Dr. Maalim, Abdi Maalim, is it safe? Does it justify performing a task even if it is outside your normal formal scope of practice?
I think Dr. Ann has appropriately answered that. Any job
Thank you.
which is out of your scope of practice is an illegal, however it can be perfect.
Thank you. Thank you for being brief, Senior. We appreciate your seniority. And Madam Jemimah, kindly proceed if you have any addition on the same.
Definitely not. We do not expect anyone to move out of their role or job description to do other people's duties, even when they are very skilled, senior, experienced, and competent. I think what we are lacking is that monitoring, the monitoring systems, and eventually, as I said, we will still have to find who will regulate these cadres who have mushroomed everywhere with all sorts of different names, and they are using nursing as entry points, and it's just become a little bit uncontrollable if you know where we are at right now. Or so we will still need to have somebody to regulate things.
Thank you, Madam Jemimah. And we move to the last question. And just as you ponder across, a very important question that brings us back to our core goal, on patient safety. And we are asking ourselves, how does misunderstanding or ignoring scope of practice by our employers directly translate into a patient harm? Do you think if Aga Khan University Hospital, Kenyatta National Hospital, and affiliate hospitals across Kenya ignore the formal scope of practice given by the Nursing Council of Kenya, do you think it has significant effect on the patient outcome? And is it necessary for our employers or healthcare providing institutions, if they do ignore the scope of practice, is it posing any harm to our patients?
So
Yes,
let me attempt,
because-
if that's okay with
Okay.
Anne.
Carry
Definitely, quality of patient care and safety should be paramount in everybody who is in the healthcare business. But we know that not everybody is that concerned about patient quality and patient safety. Others are out there to make a kill, and therefore, instead of employing nurses, you have a whole complement of healthcare assistants, maybe with only one nurse. But where things are regulated very well, then patient safety is assured, even if you have the cadre of healthcare assistant assisting the nurse. And I'm repeatedly talking about assisting, because they shouldn't be the primary care givers. They should be assisting the nurse where the accountability still remains with the nurse. And where accountability remains with the nurse, then you are assured of patient safety and quality. Where that is lacking, then patients are exposed.
Thank you, Dr. Jemimah. And we all agree on your contribution that there is possibility of poor outcome if a scope of practice is ignored, and that make us ask Dr. Anne Mukuna and the NCK fraternity is there any measure that the NCK have to reinforce the utilization and adherence of the scope of practice by all the institutions providing nursing services across Kenya? Dr. Abdi, you can start.
Yes, I just wanted to say that. Thank you very much, Jephters, for all that. In fact, you are very, very right. And recently, I actually made that comment. And this is one way that we'll be able to give job to our nurses. You know, currently what we are doing in Kenya, I'm sorry to say so, you have your kitchen garden here, and you're growing your mboga and other things. But before even feeding your own family, you want to go and export this to other people. Currently, we are experiencing shortage of health workers in the country. And we are actually struggling with how do we bring down maternal mortality, neonatal death rates. When you have one nurse, and I'm actually, Jemimah said very well, you give one nurse and 10 or 5 health assistants, whatever you call. Sincerely, we want to use as nursing council, and I'm happy my CEO is here, and also our technical officers like Dr. Anne we will want, and I'm very happy recently the head of public service actually said, when you are a regulatory institution and the people whom you are regulating or whom you are giving this service under your regulatory purpose is not following, what do we do? KRA is a regulatory institution collecting tax from us. If I fail, they have the right to take me to court. When the nursing council says, I need 1-to-1 nurse, one patient, the council says one patient, one nurse to one patient in ICU. And we have one nurse, 5 or 3 patients in ICU. That is actually calling for a disaster. I'm giving an example. This is where the nursing council will now need to move in and say, excuse me, in hospital X, we have found you have this number of qualified nurses, some of them who are not even ICU trained nurses, and you have this number of, which is the ratio of patient to. The way we do in schools, oh, you need this number of lecturers, we need this number of clinical assistants. We must do the same to the hospital, to the county governments, and the rate. We need to raise this ratio so that we can able to cap the rate of maternal mortality rates. And we want to experiment that. That's the law given to us. But
all
we
right,
are not
Dr. Abdi, you've raised a very critical point, and thank you for that. And you're asking now, if on the role of the NCK that you've explicitly explained, if the NCK, let's say in Aga Khan Hospital, we have a cadre of different nurses, like a diploma nurse or carrier SHN, is deployed with no specialty. If you find out a diploma nurse is deployed in an ICU setup, is there any legal implication from Nursing Council of Kenya that is reinforceable?
Thank you, Jephters. First and foremost, I would like to make you aware the good and fortunate, not unfortunate, the good and fortunate the situation in Kenya is every nurse, and I stand corrected, my technical people are here, whether ECN, whether diploma, whether BCN, in Kenya have basic skills to take care of a critically ill patient, either in ICU or in what do you call it, even like somebody like me who trained in the former KRN 3.5 years, I took my number of weeks in the maternity, that we have that basic. And then recently I was actually informed Middle East are taking more of Kenyan health workers because they have only people who are midwives, they don't do anything else. Laboratory technician, they will have somebody who's only taking care of urine. But when you take a laboratory officer from Kenya, this is a person who can do all the specimens. Kenya, we are lucky because our nurses are basic. They are this basic. But I agree with you. When I have an ICU and I'm taking this person to medical surgical ward, and bring what do you call somebody else who does not qualify, that is a mismatch of your work allocation. It is appropriate, and I'm very happy with the midwifery section, and in the hope of reducing maternal mortality rate, where we have technical skills, people who are highly subspecialty in reproductive or neonatal, we bring them there so they can able to take care of that. But not to take them in, and you have got a nurse, just a moment, let me finish. A nurse who is NCU, what do you call the neonatal trained, but she is in medical surgical work. That's displacement of technical. But unfortunately, we have our basic curriculum takes something which we can able to save certain lives until somebody more senior comes to take over. I ask my technical team to maybe add if have anything more.
Thank you very much.
Yeah,
thank you very much,
Dr.
Chair.
Mukuna, you can proceed.
Thank you very much. Sorry, I lost connection momentarily. And what Dr. Abdi has said is true. And this, we have documented standards in relation to the nurse to patient ratio. And in the specialized units, the standard says that at least 80% of the nurses working in that area should have formal training in that specialization. the work of enforcement in this country is very huge. And we sit many times in counties with county nurses, with CECs. We write many letters in relation to the staffing, in relation to the staff mix, in relation to many other issues related to nurses and the welfare of the nurses and the welfare and quality of patient care that they deliver. The work continues. I see someone saying Nursing Council has failed the profession terribly. We encourage you to support us in that. Let us know what is this that you think we have failed terribly in, so that we can work together, because the work of regulation is for all of us. Because even the policemen that we have, if your neighbor is constantly abusing you and you are not reporting, the police have no way of knowing. So colleagues, let us support each other. The council is, I'm not saying because I work for the council, but the council is our regulator. And when we speak ill about our regulator, about other nurses, about our county nurses, about our leadership, we speak negatively in forums where other healthcare cadres are, then we lose credibility as a profession, including yourself who is saying those things. Thank you.
Thank you. Thank you, Dr. Ann Mukuna. And we would wish to open the floor to our participants and audience. We will start with we can see that Mr. Leonard Otieno has been raising his hand throughout the session.
So just before Mr. Leonard.
Yes.
Yeah, we want to remind our participants, please use the link, register, so that we get the CPD points. Many have not registered. Out of over 500 participants, we see quite a low enrollment, so that you don't miss the point. Thank you.
Thank you. We'll start with Mr. Leonard, and then Mr. Leonard, you have 2 minutes, and then we also appreciate and recognize the presence of the emeritus former NNK president, Mr. Alfred Obengo. He's also been raising his hand. You proceed in that order. And then we have Joy Jep Ngenyo and my good friend, senior nurse who is in the United States of America, also had us insight, Mr. Gordon Asadi. And then lastly, James Moremi. I'm going to give Mr. Leonard 2 minutes, Mr. Alfred Obengo 2 minutes, then the rest take 1 minute, 30 minutes. Then we see what's next. Mr. Leonard, you can start.
Thank you very much, Jephters, for this opportunity. And thank you very much, all the speakers. Well, I wanted to clarify what Dr. Abdi was saying. Dr. Abdi was saying that we should not have what is called CNA, because even the KH-POA doesn't have what is called CNA. They have HCA, healthcare assistants. And I think that is what Dr. Abdi was also mentioning. And again, as we speak, we need to have a way forward. And just to encourage people that we are sharing the link for registration on follow-up and CPD points in the chat box. Please don't forget to register. And don't just send your email. Register, click the link and register. Thank you very much.
Thank you. Thank you, Mr. Leonard. Mr. Alfred Obengo, please unmute and proceed.
Oh, thank you so much. And I want to thank the organizers of this virtual meeting. This is a very, very important and timely discussion. I'll go straight to my point, and I just want to pick up from where Ann Mukuna left. The question that we should be asking ourselves is that, is there a gap in the labor market that the HCAs are filling? Yes. And if that gap is there, the reality is that there's very little that we can do insofar as probably curtailing the training and the existence of the HCAs. It's a reality that we must live with. I don't understand why a senator or an MP should be scared of the work of an MCA. What we need to do is that as a profession, there's no institution that is better placed to spearhead the development of a bill that will regulate the HCAs rather than the nursing and the midwifery profession. The NCK is better placed to spearhead that process, and we can use what is called as public interest as the best reason to spearhead that development of a bill to regulate HCAs, because they actually.
Thank you, Mr. Alfred Obengo.
All right. Okay.
NCK.
Okay. Thank you.
NCK is taking note of that, and
Okay.
we appreciate for
thank
your.
You. Let's have a bill to regulate them. Yes.
Thank you. Thank you. NCK is placed to spearhead the bill. NCK team, Dr. Ann Mukuna, Dr. Lista Onsongo, you are on it. Mr. Gordon Asadi.
Okay, good evening, everyone. I also want to echo what has been mentioned by Mr. Obego, that NCK is at a better place for proposing a bill to regulate this cadre that is coming up. These people are here with us, and they've been here with us for the longest time. Opportunity has come up. Several hospitals have utilized, especially the big hospital. I've seen Aga Khan, I've been to Avenue, have been to Jocham, have been to Pandia, have been to Mombasa Hospital, and I've seen how these people work. What they do mostly is, what they do improve nurses' job satisfaction, in the sense that nurses do not end up doing works that will be considered unskilled. And also their presence also help in better patient health outcome. Also their presence also help in patient safety, because most of the time, these people, they are with the patient 24/7. And these are something that have been tested worldwide. And the reason why I will say that Nursing Council is better placed to be a regulator for this profession, because worldwide, even here in the US, more than 40 states, this profession is regulated by the nursing board. And Kenya cannot act in isolation. We borrow good thing and we refuse to take the bad thing. So I will say that it is high time for the Nursing Council to take over these issues and regulate it. Thank you so much.
And thank you, Mr. Gordon Asadi. Remember, here we have the NCK board chair, Dr. Abdi. We also have the NCK chief registrar, Dr. Lista Onsongo, on board. They have taken note of that, and we want to collaborate and come up with a way that we can introduce the healthcare assistants within the nursing fraternity, which through the wisdom and leadership of our technical team of the NCK, and also the chair, Dr. Abdi, who will sit down and discuss on ways of mutual interest and mutual benefit to our patients. So last but not least, we are going to give, we have still 4 minutes. We still have 4 minutes for the audience to contribute. We are going to give this to Mr. James Morimi. Please take 1 minute, and then Joy Chepngenyo. Just 1 minute, please.
All right,
So
thank you.
Everyone would wish to speak.
All right, thank you, Jephters, and thank you. Let's Talk Nursing for organizing this. Mine has already been said. The first, I think, 2 or 3 speakers that spoke ahead of me just picked what I had wanted to say. And I support what Mr. Obengo and Mr. Gordon have said, that it's the right time that Nursing Council of Kenya take it over. And the reason I support those sentiments, it is I think we need nurses to focus more on the nursing duties, and allow the HCA to come on board and focus on the non-nurses' duties. Like now, for instance, at this era, I don't see it fitting for a nurse making bends. I don't see it fitting for a nurse doing some other things like double dusting. So I support the sentiments of the speaker that have spoken. It's the right time. We support Nursing Council of Kenya.
Thank
come
you.
out
Thank you.
and we thank you, sir.
Thank you. Thank you. Joy, I'll be so unfair if I don't give you the opportunity. Joy Chep Ngeno. Take 30 seconds.
Yeah, I want to thank the organizers of the meeting. Thank you very much. I have a concern now that the HCAs, we are being told that they need to, we take the accountability of whatever happens, whatever they do. I get that point, but why are we taking accountability of their mess if they're not regulated under NCK? That's my number one concern. Because if anything, just like us,
Wow.
doctors don't take responsibilities for anything that we do. If you make a mistake and it's a nursing mistake, I take responsibility as a nurse, and I will expect the same from them. And then on the other side, as it has been mentioned, like what gap are they trying to fill? Well, that is the big question that should be answered, so that we don't, like the CEOs when they were coming in, there was a gap. There were not enough doctors in the country. But now as we are talking, there are very many nurses who are tamaking. And the Nursing Council, I like the way Dr. Farah Maalim has, Dr. Abdi has been talking. But now I think they are failing on the ground because they are not coming to check on the people who are being employed. I know of an hospital that has a lot of, I don't know if we call them now HCAs or patient attendants than nurses. So if they don't visit the hospitals and make sure that the population that are working under nurses, they meet that number, they have talked of 80% and all that, are they implementing that, or you're just having those things in papers? I think those are the things that needs to be addressed.
Thank you. Let us give our panelists let's start with Madam Jemimah Kimeu to take 1 minute to give us your final remark on the subject matter.
Thank you, Jephters. I appreciate what has been said by James Morimi and other people. And I've seen on the chat that there are those who feel that time has come. And for us not to acknowledge that there is a need on the ground for HCAs, I think we are burying our heads in the sand. Instead, let's regulate this, because we are in an economic situation where people should have choices of who to hire. And we are not talking about institutions only. There are people who are having healthcare, taking care of patients at home. They can't afford an RN implement. So I'm urging our regulators, the Nursing Council, to have a deep discussion around this thorny issue and help us out.
Okay. Thank you. Thank you, Dr. Ann Mukuna.
Thank you. Thank you very much. And thank you, colleagues, for the feedback and the input that you have given. We take it and to the best. The council is committed to maintaining the standards of nursing and midwifery workforce. And this is an emerging issue. A technical working group has already been formed between the Ministry of Education and the Ministry of Health, and part of the TORs is to look into this regulation of the HCAs alongside the other unregulated cadres. And so this discussion is taking shape, and we hope that we will have this cadre regulated so that they can take up their own accountability out of their defined scope of practice. So thank you. Chair, I want to recognize the presence of the CEO. She was in between another task, but I can share my minutes so that if she's still in the house, at least to say hi.
Well, thank you. Oh, thank you. We actually we've preserved some few minutes for her.
Thank you very much.
Thank you, Dr. Abdi.
Thank you very much. First and foremost, because this is my last remark, allow me to sincerely thank the organizers, and we really want another forum of this, so that this we have more time and give our participants more of opportunity to raise some of the questions. I have almost 10 questions that have been asked, but I don't think I'm in a position to answer this question. Number one. Number two, there is no nursing council. You are the nursing council. And this is my slogan since I came. Nursing council is you, and you are nursing council. If you see something wrong, don't spare Abdi, don't spare Lister, don't spare Dr. Dr. Ann. Please feel free to get in touch, of course, professionally, with your input is very, very important. In my culture, we say you can be elder than me, but you cannot say that you're intelligent than me. Of course, experience gives something, but you are a young generation, you might have better ideas. Please feel free to call anytime and give us your point. Number three, we will do everything possible. And I'm happy Dr. Ann has already mentioned that intersectoral Minister of Education and Minister of Health, which was launched yesterday. The Nursing Council scope of practice must be safeguarded, so that I can have employment for these young nurses who have trained 6 years. Parents have been leaving university fees or whatever. Today, when they can believe me, community health has been taken by community health volunteers. Theater nurses has been taken by pre-operative. Okay? Medical surgical has been taken care by your healthcare assistants. The only left is, you will see tomorrow, traditional birth attendants will be given delivery certificates and to do this. I will not allow this as far as I'm the chairman of the Nursing Council of Kenya. I need your support. God bless you and thank you so much.
Thank you very much. We really appreciate you are so strong and quite appreciative and concerned in protecting the dignity of nursing and the nursing fraternity. So thank you very much, Dr. Abdi. You're quite passionate. I'm going to give this the final. We have two people going to give us the final remark. We have 1 minute going to give to the Director Nursing Services, Machakos Level 5 Hospital. Take 1 minute to give us the final remark. And also Dr. Cecilia Ndungu, the President or the Chairperson of the Advanced Practice Nurses Association of Kenya. It's a new society for the advanced nurse practitioners. We recognize your presence. So please take 1 minute each. Then we'll give Mr. Leonard Otieno, and if any, Madam Anampiu, to give us, so that we come to the end of the discussion.
What I'm saying is that it's high time we need those HCAs. We need those HCAs. You know, all the private hospitals, big, they are there, they are working, they are helping nurses. And then the main work, nurses, for nurses, the NCK had placed all the work, the time, is it called, what they are supposed to be doing, yeah? And the HCAs, they're only to deal with activities of daily living, period. Activities of daily living. We can borrow a leaf from the Texas Board of Nursing jurisprudence on the issue of, on the part of delegates. And then you see what is there doing.
All right. Thank you. Thank you. Point taken. Yes. Madam Cecilia.
Thank you so much, team, for organizing this very wonderful event and for the opportunity. We congratulate the Nursing Council for the strides they are taking so far in terms of regulation. I'd urge all of us to support the council. And as our seniors have said, let us be so optimistic about our profession. And as advanced practitioners, let's also support and work comprehensively together with other cadres of nursing. Remember, nursing is one fraternity and we cannot occupy all spaces. Thank you so much.
Thank you. Mr. Leonard, this marks the end of this panel discussion. Mr. Leonard, you can have your last remark as the co-founder of the Let's Talk Nursing.
Thank you very much, Jephters, and Anampiu for the coordination, and to our speakers. Really appreciate for supporting this. And from the charts, we can see the way forward. Most people are saying that the Nursing Council should now take up this to the next level. And again, we also encourage our associations to work together with NCK to pick up this so that they can really support Nursing Council, which is our regulator. And for the next session, we will request that in case Let's Talk Nursing is an open forum for all nurses. In case you have a topic or you have something that you want to share with the nurses, just reach out to our admins. Jephters is there, Anampiu. We also have Lorraine. We are so many, so that at least we can support, we can see when to host you. I've shared the CPD points code. You can just pick that code. It is expiring on, I think on 12th. Yeah. And again, in case you registered, please, and in case you have not registered, please register so that we can do a follow-up with the discussion that we have shared. We'll also share with you the link of the recording of this session. Thank you very much, and you are all welcome in Let's Talk Nursing. Jephters, in case maybe you have someone who can do for us the last prayer.
A volunteer.
Okay, let us pray. Father, in the mighty name of Jesus, we come before thy presence with thanksgiving in our hearts. Thanking you because you have been with us during the entire session. Thank you because you have taken care of us. Thank you because of giving us this noble profession of nursing. As we continue trusting in you, Almighty Father, may you continue blessing each and every one of us. May you continue even blessing the Nursing Council of Kenya. And may you also help us to work together as a team for the benefits of our patients. We pray that we may continue blessing the work of our hands. And above all, let your will be done in all things that we do. This humble prayer of faith, in Jesus' name we pray.